Hey everyone, thanks for tuning into our Azalea Health YouTube channel. And a special welcome to all our wonderful new subscribers. We have received great feedback from you, and we invite you to stay tuned for even more helpful content about your reproductive health. Do you spend ages researching your symptoms online but wish you can get more relatable information? If you're frustrated about dealing with abnormal symptoms, watching this video would solve that problem. First, let me introduce myself. My name is Dr. Siobhan Joseph, and I'm a board certified OBGYN. This monthly series is called You Ask Doc About, and every month I will present answers and explanations to questions asked by women in my practice in the office, as well as online across our social media platforms. I believe all women will benefit from watching this series. You'll get interesting facts you never knew, like later in this video when I talk about herbs that can work for fibroid symptoms. This is for informational purposes only. For medical advice or diagnosis, please consult with a professional. This video is part 2 of our You Ask Doc About Fibroid series. In this video, you will learn if and how you can avoid surgery, as well as useful fibroid symptom remedies. But first, let's recap. In part 1 of this series, we discuss fibroids in detail, what they are, how common they are, and what rare symptoms may exist, as well as management options. We asked for your questions and we did receive your questions. Thank you so much. So I will highlight a couple of these. At Colleen Moody 8400, thank you. You asked, what if I'm over 60 and have just one fibroid? Do I have to do surgery? Are fibroids and cysts the same? And I will say this, if you are over 60 and menopausal, which is the state where a woman has stopped having menstrual cycles on a regular basis and no longer has ovulation, fibroids actually become not in need of surgery or management because usually the symptoms have resolved with menopause. So estrogen hormone and irregular menstrual cycles feed fibroids and promote growth. So in the menopausal status, you actually have low estrogen status, and that actually naturally causes the fibroids to reduce and shrink in size and no longer be in need of management. So I'm not sure if you are over 60 and still menstruating versus not. If you're not, then you don't have to worry about it. I would always suggest monitoring abnormal symptoms. Pelvic ultrasounds are still done in menopausal women for that reason, depending on what you might be experiencing. The second part of your question was, are fibroids and cysts the same? And they're not. Cysts tend to describe fluid-filled spaces, right? So we have ovarian cysts because we have the ovary is structured such that when eggs are growing and developing and maturing, they do have to be housed in these physiological cysts in the ovary. That's normal for the ovary. When we have abnormal cysts, it's these spaces in the ovary that collect with fluid or blood and expand and become a problem. Cysts can be problematic if they're linked in any way to any form of cancer as well, too. So again, menopausal woman, 60, if you're no longer menstruating, you're less likely to develop cysts in the ovaries. And if they are found, then we do have to target and figure out where the cyst is coming from and what do we need to do about it, and also if there's any risk of cancer. Fibroids, as I discussed in part 1 of this series, are very firm rubbery growths, not generally fluid-filled in any way, and they are space-occupying in the walls of the uterus or in the cavity of the uterus or attached to the uterus. So they're quite different in that regard. Our next question that we received, and thank you so much, at Swangs, I'm going to mess this up, Swangs Comics 2157. Thank you for your question. You asked, if I have fibroids, can I still have a baby? And the answer is resoundingly yes. If you asked this question in response to the part 1 of this series, the first video, I did mention that some women will have to take steps to get pregnant, where they may require fibroid removal surgery or shrinking the fibroids and so forth. But yes, you can still have a baby. In terms of fertility, ovarian function and fibroids are two separate issues. So you can have infertility concerns with regards to your eggs and your egg quality and your egg function. You can have infertility from your tubes and whether your fallopian tubes are open and functioning. And you can have fertility issues related to fibroids, or you can have all three, unfortunately. But I will always say, yes, it's possible to have a baby as long as we get an early head start in figuring out what's wrong and what needs to be done for that reason. And thank you for your comment, and you're tuning in all the way from South Africa. So I really appreciate it. I hope to get there one day. All right. So we are going to discuss today how to avoid surgery, because that's something I am asked of almost weekly in the office. And I will be frank in saying at first that you may not be able to avoid surgery. Some women may not be able to avoid surgery if you have very large fibroids, you have multiple fibroids. You may not be able to avoid surgery if you need to improve your chances of getting pregnant, or if you have severe symptoms that are not being managed with other non-surgical options, such as very significant heavy blood loss, bleeding, causing severe anemia, or severe debilitating pain that usually occur with the menstrual periods. A hysterectomy remains the primary treatment for fibroids, followed by the myomectomy, which is the fibroid removal surgery. And these were discussed in part 1 of the series. Fibroid surgery may be inevitable for some women, but you can delay surgery if your fibroids are small, if you have no significant symptoms, or your symptoms are manageable. So one of the things I will say is, in avoiding fibroid surgery, the earlier you start the remedies will really have a better impact in how your fibroids develop. So a healthy lifestyle is the first thing, right? Eating a balanced diet, exercising regularly, reducing stress. These changes can help prevent and manage fibroids and may even shrink them. So in terms of nutritional choices, you want to eat foods that are high in fiber and potassium. In terms of fiber-rich foods, we're talking about fruits and veggies and whole grains, foods that promote bowel regularity and reduce estrogen levels. So fiber-rich foods may help prevent and slow the growth of uterine fibroids. Fiber helps the body get rid of the excess estrogen that you might have on board, which in turn feeds the fibroids, right? Then also you want to get enough vitamin D. Vitamin D is a hormone that we do not make, that we have to, get from natural sunlight or from supplements. It is recommended that vitamin D3 supplements may be effective in reducing the risk of fibroids as well too. Like I said, regular exercise, which can help lower estrogen and progesterone levels, which can help prevent fibroid growth. You want to avoid smoking, reduce caffeine and alcohol intake, and get enough sleep, right? So those things in terms of just healthier lifestyle choices. You want to avoid refined carbohydrates such as white bread, white rice, and white pasta as well. Now, there are some herbs and supplements, as I said, right? So vitamin D3 is a supplement, the healthy lifestyle option. But in terms of herbs, it's quite limited. There's a lot of gray areas where herbs are concerned. So I wanted to focus on just 2 in terms of the popularity of them and availability of data. So first, Chasteberry is a herb with a long history of balancing hormones. It is well documented in several studies that Vitex, which is also the other name for the chasteberry plant, can reduce PCOS symptoms related to excess male hormones. It can help with breast pain or mastodynia, boost breast milk production in some cases, and yes, uterine fibroids can be added to that list. This herb has been found to slow fibroid growth and help prevent their reoccurrence, especially people who would have had fibroid surgery, because in the first video I would have mentioned that fibroids come back within sometimes a 5-year window after surgery or shrinking, they recur. So this is an option to try the chasteberry plant. But like most herbs, consistent use is the key, right? The second one that I will mention, that I would highlight, forgive me if I botch the pronunciation, but because it's a Chinese herb, and I'm going to pronounce it as Guizhi Fuling Capsule, and we'll call it GZFL. Now, this is a classic traditional Chinese medicine that's prescribed, and I found it's often mentioned in online searches when you go looking for information on fibroids. This GZFL sometimes pops up. Now, it's a Chinese herbal formula that's used widely in gynecological practices in China. It is produced, from what I found, the information showed, is produced exclusively by one pharmaceutical company in China. I also found that it consists of 5 herbs, and some of the studies list out the individual properties of these herbs. So it's a blend of herbs, and it's manufactured as this capsule. Now, some pharmacological experiments show that GZFL inhibits the growth of fibroids, but larger, more randomized control studies are needed to support this claim. And how much do you need, and how many fibroids did they look at in the study? Like, there's just a lot of gray area. So I personally do not have enough supportive evidence to endorse the product, but it kept popping up online in the online searches, so I felt it was useful to look into it and just mention it to you. I also want to just have a quick word about teenagers and young women, who I also see quite a fair bit in the office, and just some key points about fibroids in teenagers. It is a low incidence to find fibroids in teens. So fibroids in teens are extremely rare, and this is thought to be due to hormonal factors. A few case studies, however, have reported fibroids in 15 and 16-year-olds, but this is still such a low number that it's estimated to just be about 1% of the general population. However, a teenager who gets their period very early, or girl rather, who gets a very early period, is a known risk factor for later developing fibroids. So most girls get their first period around age 12, and a period is considered to be early if it starts before age 11, and very early if it starts before age 9. So while getting your period at an earlier age or a later age is usually not a cause for concern, some studies suggest that girls who start menstruating early may have a slightly increased risk of developing fibroids. Also, as I mentioned in part 1, a family history of fibroids is a known risk factor as well too. So in general, I would just advise to watch out for symptoms. If a teenager is experiencing heavy menstrual bleeding, pelvic pain, or abdominal discomfort, they can be seen by a gynecologist, and it does not need to include a vaginal or a speculum examination. You don't have to worry about that. But the symptoms may signal a future diagnosis of fibroids or endometriosis. So educating teens about tracking their periods and symptoms, and also the lifestyle choices that I mentioned, can have a great impact on their future reproductive health, right? So non-surgical treatment options are good options for women who have small fibroids and fewer symptoms, as I mentioned. But these are primarily for symptom relief and are not a cure for your fibroids. Again, there's no guarantee that non-surgical options will work for you. You can manage your symptoms with anti-inflammatories, hormonal options such as the pill injections or hormonal IUD, which is very case dependent, and even medications like tranexamic acid to reduce bleeding. But you would need to have a detailed discussion with your doctor about the pros and cons of these. The fibroid embolization procedure, which is shortened to known as the UFE, or uterine artery embolization procedure, is non-invasive procedure or minimally invasive option to shrink fibroids that's been around since the 90s, but Not for everyone, right? But it is something to consider if you wish to avoid or delay surgery. But basically, a catheter is inserted into a vein, and the access point is either through your arm or your groin, depending on the specialist doing the procedure. And it's the catheter is guided through your vein to access the uterus and the blood vessels that supply the fibroids. A substance is then injected into the catheter and blocks the flow to the fibroids. This procedure is performed using x-rays and a dye to guide the catheter to get access to the fibroids, and can significantly improve pelvic pain, heavy bleeding, and urinary problems that are due to fibroids. It's also more affordable for many women to do this procedure with a shorter recovery time. But depending on your age at the time of the procedure and other important factors, number of fibroids, the location of them, and so forth, you may still later need to get some surgery for additional symptom relief. Studies vary, but an average of 10% of women may still proceed to surgery because they were not satisfied with the results of this procedure. Some women will experience varying amounts of pelvic pain and pressure, even fatigue and so forth during the recovery after this procedure, but it still beats surgery for some, and it's something to consider, especially since complications are rare. Now, the symptoms of pelvic pain are not always from fibroids, and I just also wanted to point that out as well too. Around 10% of women of reproductive age are diagnosed with endometriosis worldwide, while uterine fibroids can affect up to 80% of women by the time they reach age 50. This means a significant portion of women may overlap and have both conditions, and the exact numbers are not known. Similarly, polycystic ovarian syndrome, 5 to 10% of women worldwide, and I think personally that number is a bit higher, depending on the population you're looking at. And then you overlap that with 80% of women having fibroids, you can certainly have both conditions. So you may need to evaluate or be evaluated rather to determine which condition is causing bothersome symptoms and which options for management will be best for you. So, thank you as always for your time, and I hope you found this video helpful. Please share this information with the woman in your life that might be suffering with fibroid symptoms or at risk for fibroids. They would benefit from both parts 1 and 2 of this fibroid series. I welcome all your comments, questions, and suggestions. Stay tuned for another episode of You Ask Doc About. Next month, we will focus on the mystery of endometriosis. What is it? How is it diagnosed? What can you do about it? So subscribe to our channel and don't forget to like and share this video with your friends and family. Stay blessed. If you want more info about fibroids or you need some help with your decision process, feel free to book an online consultation with me. It's quite easy to do so via our website. You'll find all of our information linked in the description below. Looking forward to chatting with you. Take care.